My name is Humphrey Fonge. I am a cancer research scientist at the University of Saskatchewan and a professor in the College of Medicine. I come from Cameroon. My area of research is cancer drug development. What excites me is to be able to use research and make an impact in patient care. On the one hand, I have this really basic research trying to understand how all these new drugs that I'm developing work. But on the other hand, I'm also working with physicians and Health Canada to initiate clinical studies for some of these new molecules. There are really many of them against ovarian cancer, against pancreatic cancer. I have a clinical trial going on against prostate cancer. I have another one going on against lung cancer. I have one going on against colorectal cancer. So all these different cancer types.
I am Fabrice Njosu. So I come from a local community or a local village in Cameroon called Konda. My master's was in biochemistry, but right now I'm continuing staying in one aspect of biochemistry, more on the pharmaceutical development, particularly radiopharmaceuticals. We try to develop new therapeutics which are radionuclide based to fight cancer.
My name is Kweku Debiete AEC. I am from Ghana in West Africa. I am a Government of Saskatchewan employee working at the Ministry of Trade and Export Development, but I am also a PhD candidate in public policy at the University of Regina. My PhD dissertation topic is increasing breast cancer screening participation among Black women in Saskatchewan. I am also involved in a student-led group here at the University of Regina called BIPOC Graduate Students Association, which I co-founded with a couple of other students in 2022. The aim of the group is to provide platforms for BIPOC graduate students at the University of Regina to access resources, to build and expand networks, but basically to be involved in facilitators that will help them through their education program and beyond.
My name is Sophia Oluwafekemi Abiara. I'm from Lagos, Nigeria. That's where I was born. I'm more specifically Yoruba. That's my tribe. I'm a third-year student at the University of Saskatchewan. I'm focusing in exercise and sports studies, and my research is primarily focused on biomechanics. I am the president and founder of the Black Students Mentorship Association at the University of Saskatchewan. And the primary focus in the club is to facilitate and help develop the wellness of Black students on campus.
My name is Jacob Al-Hassan, and I'm an assistant professor in the Department of Community Health and Epidemiology at the College of Medicine of the University of Saskatchewan. I'm originally from Ghana. I'm from an ethnic group called the Dagomba. I pursued my PhD in this very department. I studied mostly transportation and health equity in Saskatchewan, but before that I was trained in global health, and so most of my teaching now is in the area of global health. I also teach some methodological courses to our graduate students at the College of Medicine. I mostly do research that looks at the connections between politics and health equity. Transportation has been one of the big themes in the work that I have done, where I have tried to look at how the laws of transportation within the province of Saskatchewan has affected people's ability to access healthcare services. But there's also some research that I have done on racism and how it affects people, so health, and other outcomes. So I've done racism-related research in medical education and how exposures to racism actually affect the ability of Black medical students to thrive within our province. I'm also doing some other more international kind of work. So I have a ongoing project on climate justice and how it affects health within the African context.
Black women get cancer compared to other populations, breast cancer, at lower ages, and they get more aggressive forms. The other thing is that the participation rates of Black women in breast cancer screening programs is significantly less than the white population or other populations. And so with the current policy that we have, where the free breast cancer screening starts at 50 years, it's now they're trying to phase it to 40 years. Most Black women are getting cancer lower than 40 years old. And so it is important, first of all, to increase their participation, because a lot of Black women don't participate for a variety of reasons. They don't want to hear a false positive. They don't, they feel that the mammograms themselves would cause them to get breast cancer for a variety of reasons. So to help educate more Black women the importance of breast cancer screening, but also to help change or amend that policy, because that policy is not really taking into consideration the lived experiences of Black women.
Inclusivity in research is really important, but it has to be done in an ethical way. And it's important to show and reflect the population to ensure that the results are applicable to everyone in the community. But at the same time, we have to ensure that we're being respectful and we're honoring that history is not really friendly towards minority people in research.
There's been research that were not well intended for Black people. But I also think that the regulations have since changed, and they are so stringent that no particular subject or no particular race can be used as an experimental model. It is necessary to talk to our own people, our own Black community, that at times some of these drugs can be very effective, can be very safe, and there is strong enough regulations in place not to harm a Black man versus a white man, and so they should feel comfortable to participate.
So anybody out there, if you see any studies, please go and volunteer and do it, because research is a pillar of community that I feel like I wasn't aware of the power of it.
I faced a lot of challenges getting a job. The HR person called me and sent me an email saying, "We are not giving you the job because of your accent." But, in the midst of that, in the middle of that, I always thought there would be an opportunity for someone, when someone is not going to look at the color of my skin, is not going to think about my accent, will still give me that opportunity.
One thing that kind of hinders, especially students from Africa, is that most researchers here don't understand the kind of research we do, how important it is. They feel like the research that is done back in Africa is not good enough. So they don't trust students coming from there to be able to cope or catch up. But I think coming from biochemistry, master's in Cameroon, and doing my PhD here on what I'm doing, I think my supervisors have been able to see that and they've trusted me.
You face racism, you go to places where people think, are you the one who is the professor, or are you the one? People look at you and they are not thinking that you could be the one in authority or the one who is positioned with expertise and things like that. I believe in proving beyond all reasonable doubt that you are able to do what you said you can do.
I know lateral violence, it's a big issue in our community. We need to be able to work for each other. We need to be able to vouch for each other. We need to be able to support each other.
There's also racism that Black people may have against each other, right? So there's this form of lateral violence, there's this, and that's where this sort of intersectional approach can be very useful. I think that all of those challenges, sometimes they are artificial because they come from a place of people not realizing that they could work together and have a better system. But I believe very, very firmly that the Black people that I have encountered in Saskatchewan in the time that I have lived here have been amazing people, and most of them have been people who have done incredibly well for themselves. One of the hardest things about my research, which is probably relatively unique, is that my research is very political. I do the kind of research that makes someone angry. I'm always revealing how power and politics and things like that make people sick. And so it can be difficult because yes, on the one hand, you're revealing these things that are uncomfortable. But on the other hand, the people who can make that change are both individuals, but also the government. So the very governments you're critiquing are the governments who might have to improve the lives of people by listening to what you're saying.
The difficulties or the challenges that I face as an international student doing research is, I would say, primarily financial. It can be very, very challenging.
The biggest challenge, I would say, as the president of the Black Students Mentorship Association, as well as a student researcher at the Center for Rural and Agricultural Health, is outreach and getting people to come in. So at the club, we arrange and set up these events. Like my team, we work hard to set up an event that's of high quality and an event that we as students believe that we can gain from and things that we believe would be helpful to other people. But then, like, not a lot of people show up.
I volunteer as a co-president of the College of Medicine Graduate Student Society. See, our society kind of championed a movement to support our science, which was part of a broader nationwide work. The implications of that work have been the recent federal increase in research funding. We organize a lot of wellness events to kind of improve social wellness in graduate students. Once you find a community that is able to welcome you and guide you, that is really helpful.
Get involved in your university community. You might not want to, do a PhD and make research your whole job, but getting involved is a way that we as a community can take active steps to ensure that we are getting included in these studies.
What helps me to flourish in my area of study, the people that I work with, having good mentors, having a good support system, having access to the resources that I need at the university to do my research, having good leadership at the university as well.
I really like to see young people become scientists. I really like to encourage and I do a lot of mentorship. Even my own students, I mentor them outside of being scientists. When I bring my students here, I tell them, especially the ones that come from Africa, and this is one thing I always tell them, I say, let nobody tell you that your bachelor's degree or your master's degree from a university in Nigeria is not good enough.
I think that with good mentorship and with, like a pragmatic sort of embrace of the idea that we can all do very well as a community, we could build a very strong Black community in Saskatchewan.
The African proverb, rain does not fall only on one roof. That literally translates to whatever you do, being it good or bad, doesn't just affect you. It affects everyone around you.
Ignore any doubters, to ignore any naysayers on anything you want to do, especially career-wise.
I'm thinking of one proverb from my ethnic group. It's called, they say, nobly yankupi call it. Like, you cannot pick a stone with one finger. So that means you can't do anything important on your own in this world. You must do it with people. You must work with other people if you're going to do something that's going to really go far.
Kò sọ́gbọ́n tó lè dá, kò síwá tó lè wù, kò sọ́nà tó lè wọ̀, tó lè fi táyé lọ́rùn mọ́. So that means essentially there's nothing you can do in this world to please the world. Anything you do, someone's gonna find a way to find something wrong with it. Like, I'm even talking about, planning my events and doing things right. Like, some people may say the way I did it was not good, but I did it to the best of my ability.
Wofro eduapa ni pia uto. This is a proverb from Ghana, which the literal meaning is that if you climb a good tree, you get a good boost up the tree. And the other meaning is that if you apply all the important value systems like humility, like hard work, and others, and also surround yourself with experts who have been where you're trying to go, then you get the good boost that you need to succeed in life.